Andy was a 34-year-old successful businessman, a husband, father of two. He had absolutely no risk factors for any disease, much less cancer, but he had admitted that day for biopsies of his tongue. They got the biopsy results back, and he was positive for squamous cell cancer. So Andy considered his options, and he went ahead and decided to have the surgical intervention, and he wound up having a partial glossectomy where they removed part of his tongue. The surgery went well. The surgeons thought they got it all, and he went ahead and was discharged. His spirits were high, and you really couldn't even tell that he had had surgery unless he stuck his tongue out. They wound up reconstructing his larynx and pharynx with a free flap. They also built him a new tongue, if you will. They took a piece of muscle from his forearm and reconstructed those areas. Andy conveyed to me after his surgery that he was worried about how his children saw him. They might have seen him as a monster now, as he had this breathing tube and his tongue didn't look like it should, and he's very swollen. Eventually the swelling did go down and he was discharged, but I just had a feeling that we were going to see Andy again. One afternoon, I went from the ICU, that's where I worked, and I went to visit him in his room on the floor. And he was sitting there, and I asked him how he was doing, and the phone rang. So I picked the phone up for him, and it was his son, so I held the phone up to his ear. And I overheard his son ask Andy why he hadn't been there at his birthday party that day. And the anger and emotion just kind of swelled over Andy. I could see it in his face. And he just kind of cried and shook his head. I explained to his son that he loved him very much and wished he could be there. Nothing in school prepares you for that situation, and I found that very challenging, and that case will remain with me for the rest of my life.